Hello, everybody. Welcome to our Michael Davis lecture. Actually, I'll wait. Our numbers are scrolling up here. It's my real pleasure today to introduce Ilana Ventura and Angela Garcia to talk today about immigrant remittances in the United States during COVID, from the United States to Latin America during COVID, obviously a critical issue. Ilana Ventura is a PhD candidate in the Department of Sociology and also a methodologist at NORC, and made some really wonderful contributions there. Angela, people here at Crown know, and Professor Garcia is assistant professor here, and is, for those of you that haven't read it, her book, Legal Passing, Navigating Undocumented Life and Local Immigration Laws, is really an important work. And I won't go through all of the awards that the book has won, because that would eat up too much time. But it's, but for example, the Oliver Cromwell Cox Book Award at the American Sociological Association, and quite a few other awards. It's it's just something it's an important work for those of you that haven't seen it. And welcome to both of you. Angela, let's see, I believe that Ilana is going to be the pilot of the PowerPoints today and is the first author on the paper. So Ilana, why don't I hand it over to you?
Great, thank you so much, Harold, and thank you all for being here with me today. And thank you, of course, to Angela, my co-author on this paper. So we'll just kind of dig right into it. This is a paper titled Resilient Remittances, Examining Immigrant Remittances from the United States to Latin America During COVID-19. So before we really dig into the paper findings and all of that, first I want to just make sure that we're all on the same page. So what are remittances? Well, remittances are money or goods that people who migrate send to family members in their home countries. For many, remittances are an important element of the migrant experience, linking family members in the country of origin and destination. Another important question to address is who sends these remittances. Now, plenty of research has and continues to address this question, but we do have a pretty good general idea. So lower wage and undocumented immigrants are more likely to send remittances. Immigrants who are in a place for longer amounts of time and are more integrated socioculturally are less likely to send remittances. But for those already remitting, time and place and socioeconomic integration increases the amount remitted because basically they have more money to spare. And also important to note, especially for this work, is that the second generation is less likely to remit, but they may do so more often when it's mediated by their parents, meaning when their parents basically ask them to send money, they'll probably say yes. Another important note here is that the US is also the largest remitting sending country, not only to Latin America, but also globally, recording around $68 billion in outflows, I think, last year. So that's a lot of money. At the onset of the COVID-19 pandemic, this prompted widespread projections of economic contraction and a resulting decline in immigrant remittances, which are fundamental to many migrant household survival strategies. Yet, after a quick but steep decline in remittances in the second quarter of 2020, at the beginning of the pandemic, remittances to Latin America rebounded and remained surprisingly high in comparison to their amounts the year prior. Mexico is an important case to talk about a little bit, specifically because it is the largest recipient of remittances from the US, and likewise, the US is Mexico's largest remittance sending country. So Mexico is a really important case to discuss. Mexicans alone are about a quarter of the US immigrant population and about 62% of all Latino Americans. So this is not a small bit of migrants nor money that we're talking about. Digging deeper, remittances to Mexico, which is the largest recipient of remittances from the US, remember, remained strikingly stable during the first year of the pandemic, which is this kind of highlighted section on the chart. Overall, remittances were about 3% of Mexico's GDP, valued at nearly $39 billion in 2019, and then actually jumped to almost $52 billion US dollars in 2020. So with all of this, our guiding research question is basically, why did remittances from the US to Latin America, and Mexico in particular, not decline during the pandemic's first year, especially given unprecedented strains to labor markets, social safety nets, and healthcare and educational systems? Generally speaking, the question of remittance resilience during COVID is a new one, but we are not the first to ask it. We do, however, we think at least, have an innovative approach, data, and perspective. So two related lines of explanation exist in the literature. First, the economists have two lines of thinking. Some argue that government pandemic support payments may have kept remittances afloat. However, as we noted earlier, undocumented immigrants are the most likely to remit and are ineligible for federally funded pandemic unemployment assistance and stimulus payments. Others suggest that the shift from informal, which is face-to-face sending, where you would travel, to formal channels such as Western Union, other cash-based apps of remitting, just made official remittances numbers look more stable. So in other words, this was just a shift in measurement, as informal remittances are not captured in official numbers. However, this explanation also runs into issues because undocumented immigrants cannot freely cross borders to remit in person. So this is kind of one batch of thinking. Next, we have the feminismo line of thinking, which emphasizes the primacy of Latino family. Here we might see that the extended family networks and related obligations among Latin American immigrants may help explain sustained remittances during the first year of COVID-19. However, there are also some debates within the literature, specifically that this supposed primacy of family can be a major cause of strain, and networks of resources can become strained, especially within resource-poor communities facing structural constraints. Basically, all this to say is that there's a limit to individual sending when one is simply squeezed of resources, as many were during and especially at the beginning of the pandemic. Overall, this scholarship thus underscores the likelihood of significant familial sacrifice behind the overall pattern of sustained pandemic remittances, which helps motivate our work. Drawing on the sociological literature on immigrant families, we hypothesized that macro-level remittance resiliency between the US and Latin America during the first year of COVID-19 masks heterogeneity among the type of immigrants who remit, changes in remittances patterns at the household level, and considerable strain to family in sending and receiving locales during the first year of the pandemic. Further, while feminismo literature argues that core values like strong family identification, dedication, loyalty, and mutual support undergird the structure of the Latin American family, we also hypothesize that it simply might not be enough to sustain remittances, especially in lower socioeconomic status or SES households. So to perform this study, we use a mixed method approach. Our quantitative data comes from the Survey of Latino Immigrant Families and Identities, which just, a plug, is my dissertation data survey. And here we have about 1,000 survey respondents. We sampled Latinos in the US from the first or second generation, defined by at least having one parent born in Puerto Rico or Latin America. And this survey is nationally representative, which means it's mixed socioeconomic status, mixed gender, education, basically trying to represent all of the breadth of Latinos in the US. And it was fielded by BFT Research. This happened between November 2021 and January 22, and the survey was done in English and Spanish. We then used a multinomial logistic regression to do our analysis, and I'll kind of go over what that means a little later when we start presenting findings. Our qualitative data includes 74 interviews fielded between April and August 2020 via phone. The sample was Chicago-based, predominantly low-wage and undocumented, and is part of Angela's City Key project. Important with this sample is that the respondents in these interviews were amongst the hardest hit from COVID-19, both in terms of disease and socioeconomic fallout. We then analyzed interview transcripts using the flexible coding method, which develops a logic of starting big to increase flexibility and conceptual refinement, and then using deduce, we created a set of broad codes based on interview domains and iterated as themes emerged. I'm just going to take a quick drink of water before jumping into this next slide. Sorry about that. So by design, the demographics of our two samples differ in order to provide analytical leverage. While quantitative data allows us to examine general population level patterns of remittances during the COVID-19 pandemic, qualitative data allows us to hone in on the most vulnerable and the most likely to remit prior to the pandemic and explore the why and how of how remittances remained, at least at the macro level, seemingly stable. As you can see here, I know there's a lot of small numbers. I'll try to highlight some important ones. The survey sample demographics reflect the general Latino population in the US more closely than the interview sample, with higher educational attainment and 68% of survey participants holding US citizenship. In contrast, the interview sample centers on already marginalized Latin American immigrants who are both most likely to remit and experience the negative impacts of COVID, and we mentioned in the slide before. Of the interview sample, 80% are undocumented and 60% did not graduate high school. Most interview respondents were from low-income frontline or essential workers during the pandemic, and 82% remitted at the time of the interviews. Now, jumping into some of our survey findings first. We use the survey data to estimate self-reported changes in remitting during the pandemic, thus contextualizing stability in global remittance trends reports to Latin America. Within the survey data, about half the respondents who remit maintained a stable pattern of remitting throughout the pandemic's first year. The second half of survey responses were divided roughly between those who sent less money, which is about 22%, and those who remitted more, about 27%. We have kind of three important findings here to highlight. The first being that about 56% of those who sent less money have household incomes of less than $30K a year. The second, that about 57% of those who sent more money were of the second generation, so children of immigrants. And about 64% and 51% respectively of those who sent more money and those who sent the same amount were employed full-time at the time of the survey. This kind of gives you a sense of the socioeconomic differences between people who sent more, about the same, and less money throughout the pandemic. Next, we use a multinomial logistic regression model estimating changes in remittance behavior for all the respondents who report having sent money to family and friends abroad. So this was 594 respondents. We explored covariates the individual characteristics of remitters, including household income, full-time employment, education, documentation status, being born in the US, age, household size, children, having any children in the household, and gender. In a multinomial logistic regression model, outcomes of different groups are compared to a reference group. In the case of the model shown here, the reference group is no change in remittances. Therefore, we compared the extent to which each variable in the model is associated with an increase or decrease in the odds of being in the no change first send more remittances group, or an increase or decrease in the odds of being in the no change versus send less remittances group. And here I want to highlight three important findings. First, undocumented immigrants are more likely to say that they remitted less during the pandemic. Second, larger households are less likely to decrease remittances. And third, the second generation is less likely to decrease remittances. And just a reminder, the second generation means the children of immigrants or people who were born in the United States. So now we jump to interview findings. While the survey data shows heterogeneity with the second generation remitting and also middle and upper socioeconomic status remitting, the interview data hones in on the why and how of this heterogeneity and how it extends to the second generation and beyond, to other people, other family members inside and outside the household, which we call this the expanded remittance pool. And we'll get into this little term that we're trying to throw out there into the world a little more closely momentarily. Overall, we find two basic reasons for stable remitting. First, most clearly, no job loss. And the second, which we will dive into in more depth shortly, is the idea of this expanded remittance pool. We begin with an example of someone without job loss, a 41-year-old undocumented respondent from Mexico who worked in newspaper delivery, for example, and attributed their steady income to her ability to maintain the amount and frequency with which she remitted to her mother, who relied on the money for food and medical bills. She notes, "Thank God I have never lacked work, never. With the pandemic, I started praying, talking to God and telling him this and that and thanking God for hearing me. Until now, the pandemic hasn't affected anything because, well, everything is fine." However, for others, the stability of remittances was only possible due to the efforts of multiple households within the same family, sending money together, an element not captured in the quantitative data at all. For example, for a 54-year-old man from Mexico with US citizenship who worked on commission in sales, remitting became difficult when he experienced income loss at the onset of the pandemic. His sister in another US household, however, had stable work. And so as a whole, the extended family, or this expanded remittance pool, literally pooled their resources together to remit. He explains, "We agree on how much we send, and since there are at least 3 or 4 of us who contribute, then it makes it easier for us to make this type of contribution, because I'm not making it all directly by myself." For other interview participants, living in larger US households made supporting non-migrants in communities of origin a more attainable goal, even if the focal respondent from the interview faced job insecurity. This was particularly the case in mixed status households that included members with DACA or US citizenship, who often contributed to the stability in remittances through jobs that allowed them to work remotely, an indicator of the professional, more privileged nature of their work. Considered alongside the high numbers of second-generation remitters in our survey data, this finding in the interview data is again indicative of this expanded remittance pool, a key adaptive shift to the pandemic conditions that at once reduced the ability to remit, especially for those already marginalized, and increased the need for remittances among non-migrants and communities of origin. For example, we have the case of a 25-year-old from Mexico with DACA, who worked from home for a social service provider. COVID-19 did not affect their employment. Their father, on the other hand, who was undocumented, experienced job and wage loss in the construction sector, prompting this adult child to contribute part of their earnings towards family finances and household remittances. They note, "I'm fine, thank God. It really is helpful because my dad can't work. I have to work so that I can help pay the rent. I could help pay the bills. I can help pay for food." However, this interview data also shows the strain of remitting during COVID in US receiving locales and in Latin American communities of origin. Our qualitative data also provide details on how job loss amongst the undocumented, coupled with school closures, childcare obligations, and a lack of government and extended familial support networks made it impossible to maintain remitting obligations to family members abroad, even if the respondent wanted to. Respondents, especially those in essential occupations, were acutely aware of the health risks that they faced and needed to calculate working and therefore survival with the potential of a life-threatening illness. For example, we have here a 38-year-old single mom from Mexico who worked in a restaurant and saw her hours dramatically reduced during the first months of the COVID-19 outbreak. This constrained her ability to send money to her brother. She noted, "Well, I haven't sent him money like I used to before COVID because I had more hours at work. But now I've been left without working much, so no, I couldn't send him money." Others needed to make difficult calculations on health and economic survival, with acute awareness of the health risks of working in essential positions to try to make ends meet. For instance, a 55-year-old welder worked in a factory that closed for a month and a half after a few workers died of COVID. He lost income during the closure, but once the factory opened back up, he returned to his usual hours. Nonetheless, the scare of not having steady income prompted him to reduce his remittances to his mother by about half of the pre-pandemic amounts. As he recounted, the biggest concern is that many coworkers are liars because they know that they have the coronavirus and they still show up to work. And I don't think that that little thermometer will detect that they have corona. Right now, I have to save money for when the factory says that you have to go home again because they will close again for 1-2 weeks. Whatever happens, you have to have reserves to be able to eat. Indeed, a weak social safety net, especially for immigrants who hold unauthorized status, forces many to make high-risk decisions to report to work sites that they deemed unsafe. Socioeconomic and legal precarity, especially amongst the undocumented, not only affected the lives of immigrants who could no longer remit, but also their non-migrant families and communities of origin. While the downstream effects of COVID-19 in healthcare systems include not getting care on time, full emergency rooms, and lack of regular care, the pandemic also influenced the health of recipients in Latin America by shaping the remittances that they received. Typically, non-migrant family members relied on remittances for food, housing, gas, clothing, and other essentials. For the elderly and infirm, this lack of remittances strained payments for these basic needs, a particular concern during the pandemic. For instance, a 65-year-old undocumented woman from Honduras who worked as a nanny prior to the pandemic explained that, "When I lose my job, the people who depend on me also lose." Given pandemic-induced unemployment in her household, this respondent had not been able to send remittances to her 91-year-old mother, who depended on the money for her medicine and food. Explaining the situation, she notes, "Because I no longer work, I can no longer support others." In other cases, undocumented immigrants with job loss resulted in their elderly parents in other countries going without required injections, dialysis. For others, it meant less money to pay for their parents' insulin or syringes. It is important to note that remittances dedicated to the care of the elderly also include secondary expenses beyond just the food and medicine that are also essential to their well-being. This aspect is crucial to explaining the why of the expanded remittances pool. People scrapped together what they could because others, often their aging parents, depended on them. For example, a 57-year-old restaurant worker explains, "If they are going to go to the doctor, well, they need a taxi because I tell you they can no longer move around on their own. Then the cost of their medicines, and because they are old people, they need more care. Before COVID-19, I worked more and I had a way of sending them a little more. But now, well, yes, I work, but I have to say that I can't send more because I have to pay for my living. So of course I feel like that affects them negatively." However, despite all this hardship, family members also did communicate about the drop-off in remittances throughout the pandemic more generally, which is also just a really important thing to note here. The continued communication of respondents with family members abroad, despite this reduction in remittances, was also reflected in our survey data. As we show in this figure, 42% of respondents who decreased their remittances subsequently increased their communication with friends and family abroad during the pandemic. Among all groups, most respondents report increasing or maintaining levels of communication during the COVID-19 pandemic. Thus, we suggest that this evidence of decreased remittances does not signify weakened relationships, but rather specifically the duress that migrants faced at the onset of COVID-19. For example, a 40-year-old factory worker from Honduras who was unable to send money to her mother explained that they spoke about these reduced remittances. She recalled, "We talk to each other on WhatsApp and we look at each other, and she, my mother, says that as long as there is faith, we have to pray," she says, "so that God forgives us and takes away the pandemic." So now kind of shifting to an overall view of what we've been talking about for this last period of time. In both data sets, we find evidence of an expanded remittance pool, wherein remittances from households without job loss were shored up by the employment of others. We also emphasize that loss of employment and income by migrants to the US was also felt by family members abroad who received remittances prior to the pandemic, especially the elderly and infirmed who used remittances to cover their healthcare costs. However, and most importantly, these family members did communicate about the drop-off in remittances throughout the pandemic. And more generally, this lack of remittances did not mean a lack of love and care. Also, for future research, which I also admit is a shameless plug of my dissertation, we argue that scholarship needs to start thinking more about transnationalism and remittances beyond the first generation, and also throughout the migrant life course. While the assimilation literature argues that transnationalism, remittances, and other homeland connections should wane over time and over generations, children and the children of immigrants, we find that this is not the case in times of duress, which gives us an excellent inlet to explore how, when, and why the second generation and other more established immigrants maintain this transnational connection at different points in their lives. No need to go through these references, but we do have a ton of people to acknowledge, research assistants, funders, that this work would not be possible without. And with all that, I thank you for listening to me talk for a half an hour, and welcome the conversation and questions that are to follow.
Thank you so much. That was a great video. Folks, if folks have questions, if you can put it in the chat, that would be helpful. Dave Ennis has one question to start us off. Did you address the cost of transmitting remittances? I think they are very costly in many countries, particularly India. And how would this affect the amount of remittance? Of course, India is a little far from Latin America, but I'm sure the same issue is also present there.
Yeah, we did not actually talk about the cost of remittances in this work, but I actually have seen some work come out recently about the cost of remitting during COVID. So I definitely would emphasize that this is very important, but we did actually not talk about it. I don't know if Angela, you wanted to address anything else here.
I think that's a great question. And while we don't address it in the study, I think what I would underscore is, ironically, the better off immigrants are, the less likely they are to send remittances overall. And so it's the poorest workers who are responsible for kind of keeping their home countries going, if we think about the role of remittances in development. And there are, I think, important implications of this situation that are complex if we think about the practices of financial firms that skim excessive commissions and fees from that flow of money. But there's also implications if we think about the ways that remittances serve as escape valves for the governments of sending countries who don't feel the pressure to reform social policies and the like that are impacting outmigration overall.
A couple follow-ups to that I was, as you were talking. One question, COVID has accelerated technology of various sorts, whether it's Zoom or the use of Venmo and things like that. Have there been any sort of changes in the technologies that people use either to be in touch with their families or to transmit resources to their families in a way that may have been more difficult, 2.5 years ago?
That's a great question. One of the things that we did see a lot during the interviews is the use of just WhatsApp generally. I mean, I think WhatsApp is not as common within the US. Here, I guess we text, we FaceTime, but it really seems to be quite common, even with elderly relatives, that people do have a widespread access to cell phones. Obviously, not everybody, but talking, chatting, chat groups for family members is super common. Now, I don't really know too much, and it is a great question, about the spread of other sorts of technologies. Obviously, Western Union, super common. They also have an app. Has definitely been in existence before the pandemic. I know that in India and in Asia generally, there are other app-based remitting and general financial platforms, but I don't know too much about them. But it definitely would be interesting to learn more about.
A couple more questions, and then and please put questions in the Q&A in the chat as you wish. One thing you didn't really talk about that much was the wealth position of people, and certainly there's quite a few people who really are day to day have no wealth, but there's also, I mean, this is a community that does have a high savings rate and does have various forms of wealth. And how did people's remittance behavior? How did it reflect, say whether people were homeowners or whether they had, or just where they were in the pandemic in terms of how the stock market was doing and all this other stuff? Is there anything interesting that was happening to people's wealth holdings that should also be part of this story?
Well, I think a really important thing to note is that a lot of the more likely remitters do not have a lot of wealth. I think that's an important aspect in why the financial strain that came with job loss during the pandemic was so important. However, that also aligns with why the notion of this expanded remittance pool going into the second generation is a crucial finding of our work, because while the second generation that is more likely to have a little bit more wealth don't usually remit, we see evidence of increased second generation remitting. Even if parents are undocumented, they might ask their documented or documented children to help out. And these are people with more job stability, just because of their documentation status, also more likely to have better jobs, be able to work remotely, all that allowing them to help out their parents. But in terms of looking at things like the correlation between homeownership and remitting and things of that sort, that's definitely a great opportunity for further research. But I think that would probably dig a little bit more into the people who are generally less likely to remit, at least from what we know prior to the pandemic. Once you buy a house, once you bring in your other family members, let's say to live in said house, you're much less likely to be sending remittances to family members abroad.
A question in the chat from Catherine. Two questions. One, did you get confirmation or have those surveys look back to see if they were just feeling they were sending more / less / the same, or any type of confirmation that that they were sending more or less of the same remittances? So sort of, I guess, a kind of data recollection, data validity question.
No, we just asked, are you, for the people who do send remittances, right? There was kind of the opening question. And then for those who do send remittance, we asked, has it increased, decreased, or stayed about the same during the pandemic? So it was purely based on their recollection. We did later ask, on average, about how much do you send each time, but that was not a before pandemic, after pandemic question. However, during the interviews, there was the follow-up, there was all the questions about their remitting and their change in remitting during COVID, and people there did say, you know, I used to send $100 every 2 weeks, now I don't send any, or now I send, you know, 40 or 10. And so in the interviews, when we really got into the kind of qualitative meat of these questions, the how and the why, there people did give us numbers that made it pretty clear that, you know, dropping from $100 or $200 every 2 weeks to, you know, 20 or 40 is a huge drop off.
Same, Catherine, had a second question too. It was addressed slightly by a respondent quote and sort of outside what's considered normal remittances. But how do you take into context those who aren't paying typical international remittances, but are the younger generation supporting their undocumented families in the US or in the same household?
Is that with respect to remitting or just supporting their
A
parents?
little bit unclear to me. I think it's a little bit of both, that folks are doing, maybe it's their extended, maybe it gets to your sort of extended remittance network concept.
So I think that is kind of part of what we are finding in this work, that children or other extended family members that have more financial stability are supporting their parents who may not have that stability. Mm-hmm. And that financial support also then helps extend to remitting to family members abroad. So that's what we call the expanded remittance pool. Mm-hmm. Now, there's also cases that we had found in the interview data that when people did not have work, when they didn't have financial resources and they were scrapped for just about anything during the pandemic, they did have to reach out for help for children from other family members. And sometimes that just wasn't enough to then also remit, right? People tend to cover at least their food and their rent before they send the extra to remit. And when people can work extra hours, they will have that extra amount to send to family members abroad. And at least what we know through the literature, a lot of people really do navigate and negotiate their work in order to be able to prioritize sending money to their oftentimes aging parents or children in their home countries. But if you don't have a job at all, there's nothing you can do.
Then Ivy in the chat, Ivy Hernandez, were there any differences based on regions in the US or Latin American countries? For example, patterns on remittances based on urban or rural or urban or region areas?
That's a great question. We did not look regionally. Unfortunately, our survey data does not go that far down in geography just due to disclosure. And in terms of our interview data, it was Chicago-based. So all of our interview respondents were intentionally sampled to be within Chicago, lower SES, and predominantly undocumented immigrants. And I don't know if, Angela, you want to say maybe anything else about that.
Yeah, I would just add, I think that's a great question, Ivy, and we have some data limitations to consider in responding to it. But in terms of having a logic around the qualitative data sampling from the immigrant community in Chicago, in particular those who lack authorization status, I think one way to think about it is that even though we've seen a great kind of dispersion of immigrants across new destinations in the Sun Belt and the Rust Belt and the like, the majority of undocumented people still live in urban areas, and Chicago is one of the top 10 receiving locales in the country, and it has been for a really long time. So if we think sort of about, what the qualitative data says about the state of affairs for undocumented people from Latin America, how they've been able to remit across the pandemic, there is some logic there to think about the majority of undocumented people living in cities and working in similar kinds of positions when we think about frontline workers and the like.
So one thing, so there is a lot of concern about the issues that you're raising today. If the city of Chicago suddenly came and said, I'm going to give your study team $50 million to help the people that are facing these challenges, what would you do that you think would be helpful for both the individuals who are Chicago residents and also their needy loved ones that they're attempting to support by sending remittances? I have to warn you, I don't actually have $50 million. I'm, but you could imagine philanthropic sources offering, or government sources offering resources. How would you spend it?
That's a great question. There's probably a lot of different approaches, but I'll tell you the one that came to my head first, which is a modified version of like a universal basic income program, especially targeting people who are undocumented, who haven't had the ability to tap into other kinds of COVID government supports. So I would think about a UBI where we would trust immigrant families to know how to best spend that income, that additional income coming into their households, and knowing that given the strong patterns of remittances sort of across time since we've been able to track this, that much of that extra income is going to flow towards loved ones back home in the form of remittances. Ilana, though, I'm interested in what your response is to this question.
It was going to be basically about the same thing that you said. Thankfully, Angela and I are on similar brain wavelengths while writing this paper as well. But one of the also interesting things that I don't think we were able to just address in this paper was also how acutely aware some of these undocumented respondents were of the fact that they did not get pandemic assistance. And so I think just being able to extend, the $1,200 payments, or, however much the different payments did add up to, really was able to help low income Americans kind of get through. Obviously, it wasn't nearly enough with the pandemic strain and job loss, but the fact of the matter was that undocumented immigrants, especially those with documented, U.S. born children, they said in the interviews, like, we know we didn't get this money because we are undocumented, the government doesn't support us, and I have, an American born child, and I'm struggling to support them, and the government doesn't care about us, and that much was very clear, and the struggle that they faced was also really clear.
There, another question in the chat, following up on Harold's comments about new technologies for transferring money. Are there any organizations that can assist those hardworking people in sending remittances at lower cost?
That's a great question. I have no idea, but I mean, that would be a great place for a startup. But then you have to make money, right? So people are always going to try to skim some off the top. I think that's really the problem. There are some banks that I do know allow for kind of these transnational accounts that different people can pull from. But that is kind of very specific, and then you need to have access to formal banking. And I think that is one of the hardest issues, that especially in rural places in Mexico, Central America, Latin America, that you're not necessarily going to have access to formal banking. And so even if you had a joint account with a family member, you can't necessarily access that money. And so that's why places like Western Union have become so popular, because you can have a Western Union post literally in the middle of nowhere and still get remittances.
One thing, Go
I'm
ahead.
sorry. I
No,
just wanted
please.
to add a little bit onto that, that I think there's some considerations legislatively. So there's money laundering considerations, which is why a lot of this is really difficult. And then there's tax considerations. So if you have a bank account in another country, there can be tax implications there. So I think it's a great idea, but there's probably a whole lot of red tape around taxes and federal money laundering laws that would need to be sorted to figure this out.
Yeah, I must say, as we're talking, it's so hard to navigate a conversation like this without starting to get into just the fundamental contradiction between our legal framework and the reality of how we have an integrated economy with major parts of Latin America and elsewhere where we rely on the labor of people who are unauthorized in the United States to do such critical work. And has the public discourse over immigration and everything that comes with it, has there been any change during COVID, as we've all witnessed the fact that so many essential workers are clearly immigrants or undocumented people? I mean, that's just obvious to anyone who eats a hamburger or has a relative who's getting long-term care, that a lot of the people doing that work are documented or undocumented and so on. Is anybody tracking sort of public opinion about what is politically possible in terms of the kinds of changes that we might be making to deal with these challenges?
I'll jump in and please, Leanna, if you've got thoughts here too. So, I mean, I think it's hard to, yes, we have been tracking public opinion on these issues through COVID, but obviously COVID's not the only thing that's happening. It's impacting public opinion around immigrants, immigration reform and the like. And, even when we look at this over time and, way longer span of time than just pre or post COVID, we can see a pretty consistent support in the U.S. Public for immigration reform, for legalization programs. But just to put my negativity on display here, it doesn't really seem to matter in terms of actually moving forward legislation. So we haven't had a significant reform that includes a legalization program since 1986. So similarly, just like the majority of the US public supports wearing masks on airplanes and public transportation, we also see, a collapse of that mask mandate in those places. So I don't want to say the public opinion doesn't matter, but I wonder how much it matters. I don't know that we've hit that threshold yet, given the loggerheads that we're at with comprehensive immigration reform.
That seems, it's not the only domain of American politics where institutional gridlock seems to be profound. One thing in Chicago is there's been such a rapid increase in the population share of immigrants, and people from Latin America or connected to Latin America are a much larger fraction of the city than 10 or 20 years ago. Has that altered what's possible to do in local public policy? Forget about comprehensive immigration reform, but in the city of Chicago, it seems like there should be a real political ability to do things.
Yes, I think we absolutely see that in the city of Chicago in many different ways. So we can look at, Chicago's had a sanctuary ordinance on the books since the 1980s, first passed under Harold Washington. And we can think about all the different kind of iterations of sanctuary, municipal ID. Obviously, I've got a project on that. There's language justice in the works. And even like the city of Chicago's work around fines and fees has, considered the impact of fines and fees on people without documentation status, the way that it's considering fines and fees on people with lower SES or people with disabilities and the like. So there's absolutely movement. And I think, given what the kind of loggerheads that we're at the federal level, all of the movement is happening at the state and local level when we look at immigration policy reform, especially in a progressive manner. And in that said, again, I'll put my sort of a little pessimism on the top here. There are limits to what cities and states can do. And that's especially important when we think about immigration enforcement. or sort of protections around immigration enforcement or defenses from it. But it's also important when we think about these pandemic support payments, for example, or extending unemployment insurance to people who are undocumented. The city of Chicago did a lot to, for example, shore up supports for rent, to shore up supports for people who lost their work, and they made those programs available to undocumented people, just like the universal basic income trial that's running in Chicago will be available to people regardless of immigration status. But the demand, it can't meet the support that's offered at the city level. I think even if the city was more generous, the demand would be too big. And so you see a real limitation in what cities and localities can do. Despite that, absolutely, they can do that work, and I hope should do more of that work in the future.
So apologies for monopolizing the questions with my own policy questions. One thing I'm also wondering about is the extent that the countries in Latin America are interfaced with the U.S. government about remittance issues during COVID. And you would think that the government of Mexico, for example, would be talking to the Biden administration about, because remittances are just an important economic issue for families and for the country. And has there been sort of diplomatic conversation about how to do remittances in the best way for, it seems, or is this something that's kind of, people know this is happening, but is really not something that is a transparent part of public conversation between these governments?
Well, I can't speak specifically to during the times of COVID. But the Mexican government is definitely acutely aware of how much remittances they get. It's tracked, the data comes from their central bank, right? That's how we know what's going on. In terms of coordinating with the federal government, that I'm not quite sure, but definitely, as Angela noted before, there's a lot of concern for money laundering and things like that. So there's definitely laws around how these remittances are tracked. But going more local, and I think that's where things get interesting. There are definitely, there have been programs in the past that the government will match remittances coming from certain communities in the U.S. For example, for infrastructure projects in rural areas that the Mexican government might probably not really have the resources to fund a new school or a new church or hospitals, roads, ambulances, things of this sort, but have been funded majorly by groups of immigrants basically remitting together. Often, in the literature, it's called hometown associations, bringing together money and sending as a group to their communities of origin. And there have been programs, like I mentioned, where the government actually will work with these local communities and match these remittances up to a certain amount or something of that sort, specifically for these local infrastructure projects. So in that way, it's not directly with the federal government, but it's with community groups to, yes, Exit and Voice is definitely the book that I'm thinking about right now, that help sustain infrastructure, taking into account very acutely the fact that there is such a reliance on remittances. And Angela, I don't know if you want to add anything else there.
No, just plugging this excellent book by my colleague Laura Duquette-Ruri, who's written extensively on hometown associations remitting to Mexico and sort of what that means around local democracy when you have a group of migrants who are no longer living in the community of origin, but who have at times an oversized voice in what happens in that community of origin, who might want to use remittances for a soccer field, whereas folks in the town might want to use remittances alongside with government support to, I don't know, like reform a school or have a safer water source, those kinds of things. So there's real questions around local democracy. And interestingly, Lauren's work more recently is looking at the interface between drug war violence in Mexico and towns that are receiving remittances, and finding a real connection between the two. So plugging her work generally for folks who are interested in this topic.
One thing I was also wondering about is credit markets. Are people borrowing money so they can do remittances? And it seems to me one of the financial burdens could be, I have a 91-year-old mom. I really have to send money home, but I'm currently sheltered and I'm currently physically distanced from COVID. So I start borrowing money, and now I run into trouble financially because I've got this debt burden. Did people talk about those kinds of issues in the surveys?
In our qualitative data, we have some evidence that suggests, I guess what I would say is like maybe the dark side of an expanded remittance pool, which is just that, it sounds like a lovely thing when one person is under duress, others chip in and still send money, even if it's a lesser amount. But there's a real kind of familial obligation and expectation that you would extend yourself out that way. And we know that sometimes, sorry, my cat, we know that sometimes family ties are strong, but also can be exploitative or toxic. Daisy De Real at USC has a wonderful paper called Toxic Ties that really takes the familial literature to task and says that, yes, ties are tight, but that doesn't mean that they're good or supportive. And so to your question, Harold, in the qualitative data, we don't see formal borrowing, but we do see informal kind of extensions of will you help out. And there is definitely evidence within the qualitative data that can mean that you're indebted to someone that maybe you don't want to be, that can have a negative impact potentially on family relationships.
And you also, you're dependent on someone in an exploitative way, and you're not able to potentially access public authorities in the way that other people might be able to. So you're really, that does seem frightening in terms of some of the scenarios that I'm sure happen there. What have I not asked you in this conversation that often comes up, or that as you were listening, I should have asked you?
That's a good question. So I'm gonna pivot to Ilana. Well, I guess what I'll say is one of the things that I think never mind. I'm gonna let you answer first, and then if you don't have an answer, Ilana, I will say my thing.
Well, I think I don't know if there's any questions specifically, but I think general topic-wise, I think one of the interesting findings that has really come out of this work related to this expanded remittance pool is the importance of the adult children, the second generation, who perhaps might not have been the people who were remitting, but might be called to remit by their parents, but also the importance of the fact that we have a generation of people who are either documented or documented young Americans coming of age, who are also going to be creating their own relationships with family members in the countries of origin. Even though they might not ever have lived there, they might not necessarily have relationships with all the people there or with those countries, but they're going to also come into their own about what does it mean to be, for example, Mexican, Guatemalan, Honduran, Chilean American, right? And all of that is also going to impact moving forward how they consider the idea of supporting family members abroad if they do, or creating their own transnational relationships, which is a shameless plug again for my own work. But I think it's also really interesting to consider all that within the space of life course conversations, right? A lot of people who are in the demographic space are privy to discuss different life processes of the life course and how those change as people get older. And now a lot of the people in our qualitative sample who are remitting are people in their 40s, 50s, 60s, people with aging family members abroad who they left once they migrated, right? But what happens to either their grandchildren or people of different ages? How are they going to conceive of the notion or the obligation of remitting as they too age? And so I think that that's a very important place for us to start thinking about, because this is also a generation of people who are going to come into more financial resources. What are they going to do with it? And you know, there's been cases that I found in my own dissertation work where the second generation find kind of their own way of being Puerto Rican American or Mexican American, which takes them to actually spend time working, living, buying property in their familial countries of origin, but in very different ways than their parents would have. And that's still a financial transfer that has, I would argue, important implications that is not really studied or considered as much in the literature.
Angela, you were going to come in as well.
Well, I'm so glad you plugged your dissertation, because what I was going to do is really think about this question that you're putting on the table here, which is we think kind of in the traditional assimilation literature way that people over time, so the second generation and the first generation, depending on how long they live in the destination country, are going to become more like the people in the destination country. That's sort of the assimilation literature writ large, right? Summed up in 20 seconds or less. But what Ilana's what your dissertation is pointing to is some conditions under which that might not occur. And so one of the things that you're pointing to with your dissertation work is a stronger connection with the second generation to the family's community of origin, the parents' community of origin, than we might expect, given what the assimilation literature tells us. And one of the mechanisms that you're identifying to sort of probe that a bit more is remittances in this paper, but then also this question of investment in the parents' community of origin. When we think about land holdings or purchasing a second home, or these kinds of things that the second generation, as they expand socioeconomic status, might engage in outside of the United States, which is a strain for assimilation theorists to kind of comprehend how that might be, given what that theory has told us about what we should expect to happen. And so I think that your dissertation data is pointing us in interesting directions that are going to stretch the limitations of that theory. But circling back to remittances, this is definitely one point of the paper that we want to underscore, both in the talk, but and in the article. Once we get it off to the reviewers, is it's very uncommon to find second generation remitting at the levels that the survey data in this paper indicate. And we think that's a pretty critical point about what it means to remit during COVID and the strains that are placed on immigrant families, but also the ways that people navigate those strains, because there's not a lot of other options available to folks rather than navigate those strains, given what's on the line regarding remittances for both the survey and interview data. So this wasn't primarily remitting for beyond what we might consider basic needs. And that's a really critical point.
Well, one thing that might be more of a positive in a way I was going to ask you about is we have had, I mean, the macro economy is performing well in a lot of ways. And at least it's in the latter part of the COVID crisis, we've had a tremendous amount of fiscal stimulus that must be raising wages for many of the people that we're talking about. And there must be an element where some people are actually finding that there's real demand for their labor, and they have more resources for remittances. And it seems to me one thing that is striking about COVID is it has not produced a macroeconomic catastrophe in the way that it might have. And in fact, there was such an incredible infusion of resources, even if it didn't go directly to those individuals. It went to in ways that I'm sure mattered for them in the labor market. And did people talk about how those things rippled through and provided them with resources that they might not have otherwise had, even though they weren't direct beneficiaries of many of these programs?
So I think that two things. I think that you're pressing up on a limitation of the paper, which is that we only look at, I mean, I shouldn't say only. We have great data that looks at the first year of the pandemic, which is before, at least for the folks in the interview data. Remember, those are the lower SES, mostly undocumented people, before the labor market really picked up for them. So if we extended this study out, I think what we would see right now is that not a lot of people in the interview data are continuing to struggle with finding work and finding hours. In fact, they have a lot of different opportunities to go to different places. As you know, everybody is hiring. And so there's not that strain that there was during that initial period where restaurants were closed, daycares were closed, everything was just closed. And even though we had folks in essential worker positions, their hours, their wages were also impacted. So I think if we extended the study out and looked at the second, third, I will not say fourth year of COVID, what it might look like in terms of remittances. Are people making up for what they might have sent when they had less, lower incomes? With, you know, if money's more flush now, are they sending more back? Are they investing in other ways? Are they putting something away in terms of like a nest egg? Because now it's hammered home for all of us how quickly the world can turn on a dime, and are people maybe saving more? And we don't have answers to those questions, but I think that we could, and I'll make a note of this, we should mention that in the discussion section of the paper, that this is a story about the first year, and that it will definitely look different if we extended it out. Ilana, what do you think about that? Do you have a different response or a similar response?
Very similar.
By the way, I also wonder, I mean, there's sort of, I haven't seen, the macroeconomy has boomed, but there's also, of course, we now have a high degree of inflation, and how that affects the people you're talking about, I don't think has received much public attention. And I don't actually know what is the impact on people who are undocumented when you have a period of high inflation. We haven't had that for 40 years. Are you hearing anything when you talk to people about things like that?
Well, I don't know how different it would be for undocumented immigrants versus just general folk who are low SES and don't have money, you know, in the stock market, right? People especially who are undocumented, lower on the, you know, socioeconomic totem pole in essential workers or in essential jobs, or even in cash-based jobs, right? Those prices would have to be raised, for example, at restaurants, things of that sort, to catch up. And I'm not sure that that's necessarily what's happening. And so I think for those who are working in the cash-based economy, inflation would hit them that much harder. And so I think that that's something moving forward, that even though people do have perhaps more hours in whatever, you know, restaurant or childcare now compared to a year and a half ago, I'm not sure the extent to which that would keep up without having to get more hours just to keep up, and how that would negatively influence the amount of labor that they have to put in to make ends meet, given inflation.
Well, I think we're sort of coming up on the witching hour. I think if anybody has any last question that they wish to get to, but I think that this is really wonderful stuff, and it's a great example. The fact that some of the connection to the city key is so interesting to me, and it's also a great illustration of when you do things that help people, it creates opportunities to learn important things from a research perspective that otherwise you have no relationship with people to necessarily be able to engage. So thank you, both of you. If you just want to make any last comments before we send our audience on their way, I think this has been a wonderful conversation.
Just thank you, Harold, for the comments, and thank everyone. Thank you all for attending and for your feedback and listening to the paper.
Yes, seconding everything Angela said. Thank you, everyone, and thank you, Harold, for helping us keep this conversation going and super interesting today.
Well, it's important. It's important work. Thank you for sharing it with us, and thank you everyone for attending. And I look forward to the next Davis lecture. And I think I'll just thank everyone for joining. Thank you, everybody.